Ready to transform your hairline? You've come at the perfect place. Suppose you are in your late 20s and you already have receding angles and thinning in between, such that the thinning extends towards the transition zone. What will you do? You will definitely want to seek help from your hair doctor, and then you'll start searching for hair doctors. So, how to search for a hair doctor and how you would look after your hair transplant? I'll give you a few tips for that. If you download Saraswat Hospital App and you click on the PeekAI feature, you'll be able to upload your pictures, and then what will happen, I'll tell you in the middle of the video. First of all, let me introduce myself. My name is Dr. Preeti Saraswat. I'm an American board certified hair transplant surgeon, and we've been working in Saraswat Hospital Agra for more than a decade now. The hair transplant is being done here for more than 17 years under the umbrella of our lead cosmetic plastic surgeon, Dr. Satya Saraswat. Our today's patient was suffering from hair loss for about 4 to 5 years. He has a history of baldness from his father's side. He took a few medications like multivitamins from some doctor, and he was slightly distressed about this problem. He wanted to have a long-term solution for this problem. So therefore, he approached us. Please like this video. The Norwood Hamilton grading for this patient was about 3 nearing 4. And when we did a trichoscopy for him, we found out that the donor area was good enough. We could take sufficient number of grafts from the donor area. The density of grafts at the donor area was around 80 per centimeter square, and the diameter of individual shafts at the donor site was around 0.078 millimeters. These were mainly terminal hairs. When we did calculations for the recipient area, we knew that the area which required transplant was around 115 centimeters square. It included the front and the mid of the scalp. The density which we were looking at giving him was around 35 grafts per centimeter square. The detailed trioscopy you can see on the screen. If you want to ask us any question regarding long-term planning and treatment of this patient, or for yourself or any of your family and friends, you can write in the comment section below, or you can WhatsApp us or call us on the numbers below. On the day of procedure, we made a hairline to which the patient and us, we both consented. Then we took him for the surgery. We gave a local anesthesia first, then we made slits for him. We used a counter for slits so that we knew exactly how many grafts were to be transplanted. Then we took out the grafts from the safe donor area. In FUE, it is very important that you do not go beyond the safe donor area. Then we put the grafts in the pre-made slits, and then the procedure was done. After giving him proper post-op instructions and medications, he left for home. Then he was in touch with us because we had given phone numbers of a few of our staff, and then he came for PRP in 3 months. You can now see him at 7 months, and we are showing the combing video also. In the combing video, you should see that the hairline is so smooth, and in the combing video, the important thing is that natural hairline is there. The hairline grafts are thinner than the rest of the grafts, and it is soft and natural. Still, many grafts would be there which will come out in days to come, but still at 7 months, his transformation is amazing. If you want to see which grade of hair loss you are in, you can click on the link above. And now let us discuss the PeekAI feature of Saraswat Hospital App. So I was telling you, once you download the app, you upload your pictures, and then you'll receive within 24 to 48 hours a mail from our side in which your pictures would be there as how you would look after your hair transplant. Amazing, isn't it? And not only that, we will suggest you how many approximate number of grafts would be required by you, and when you go for consultation, what will be good questions which you should ask your doctor so that you also understand what all is to be done in your case. तो आइए देखते हैं आज की वीडियो में क्या इंपॉर्टेंट खास बातें थी. फर्स्ट ऑफ ऑल, जिन डॉक्टर से आप बात कर रहे हो कंसल्टेशन के लिए, द डॉक्टर शुड हैव गुड क्रेडेंशियल्स. अमेरिकन बोर्ड सर्टिफाइड हेयर ट्रांसप्लांट सर्जन्स, डिफरेंट इंटरनेशनल और नेशनल ऑर्गेनाइजेशन के मेंबर्स होने चाहिए वो, एंड ऑल्सो जो उनका क्लिनिक है वो भी सर्टिफाइड होना चाहिए. इट शुड बी लाइसेंस्ड टू परफॉर्म द प्रोसीजर. द FUE मशीन शुड हैव अ ग्राफ्ट काउंटर, जिससे आपको भी पता हो कि कितने ग्राफ्ट्स दिए जा रहे हैं. एंड अपार्ट फ्रॉम दैट, ट्राइकोस्कोपी शुड बी डन एज अ रूल फॉर एवरी पेशेंट, बिकॉज ट्राइकोस्कोपी से पता चलेगा कि आपके पीछे जो ग्राफ्ट्स है उनकी हेल्थ क्या है, उनका डायमीटर कितना है, उनकी डेंसिटी कितनी है, और जब वो ग्राफ्ट्स आपके आगे लगाए जाएंगे तो आपका रिजल्ट कैसा एक्सपेक्टेड होगा. अपार्ट फ्रॉम दैट, द डॉक्टर एंड टीम should be experienced and there should be good hand holding for you. Last but not the least, आपकी सेफ्टी नंबर 1 है. So they should have proper protocols for everything along with good tools and instruments for good safety profile. Please share this video with someone who is planning a hair transplant. If you want to know about cost of hair transplant, please click the video on the left, and if you want to see our latest hair transplant testimonial video, please click the video on the right.